A 911 call will send emergency medical help to you in minutes, but if you need to be transported to a hospital, a ride in an ambulance is something you might want to reconsider.
Public outrage is growing over unexpected and expensive bills for ambulance service that can soar upwards of $3,000 to $4,000. Joining us with more details, Alice Benjamin, an emergency room RN and clinical nurse specialist. Good morning.
Good morning.
So you say that misunderstandings, they can begin long before even the ambulance shows up. So let's start with what the difference would be then between an ambulance and an EMS and who shows up when you call 911.
Right, so if you think of an ambulance, it's the modality of transportation. So there are non-emergency ambulance rides. So for example, if someone's bedbound and needs a ride to their doctor's office, they may need assistance from an ambulance.
Okay.
But when we talk about EMS, emergency medical services, these are the ambulance and the crews that typically respond to your 911 emergency phone calls.
And how do you know if your emergency requires ambulance transport?
Well, it's called an emergency because we can never plan for these things and we really don't know what's happening. So when in doubt, I want to encourage people to, yes, call 911 to ask for emergency services. But as a consumer of these services, there are some things that you need to know. You need to be informed. So for example, many people believe that ambulance services in emergency situations are covered by their insurances, when in fact they are not always covered.
Okay.
Or it might be a copay or a percentage. So you as a consumer need to be aware of what does your plan cover and is it appropriate to call. So if you think someone's having a heart attack, a stroke, there's been an accident, absolutely call 911.
Yeah. Well, here's the thing too, and this happened to me personally where I called 911, something was happening with the baby, I was very scared. They show up, that's covered, but then they said to me, he's okay, that's what you want to hear. We advise you maybe not to get into the ambulance if you feel you want to go, you're close to the hospital, drive yourself. Which was really interesting advice that I never thought of. So never fear to call 911, but it's at that moment to get that advice whether or not you should get in the ambulance, right?
And you can ask the person, the responder,
yeah.
Do I really need an ambulance or not?
So these are trained healthcare professionals, so they can advise you on what to do. So yes, as taxpayers, the 911 dispatch, the emergency response to your home for an assessment and maybe basic first aid is covered under taxes. Now, if they deem the situation is not life-threatening, they will make the recommendations to say, hey, does it really require an ambulance ride, but perhaps follow up with your primary provider. But if you decide that, yes, I still want to go to the hospital, or they deem that it's medically necessary that you need to go to the hospital, that's when those ambulance charges can occur.
And how much? How do you know how much that will
cost? Oh gosh, I wish I could answer that question. There really is no regulation to what an ambulance service can cost. So, but fortunately here in LA County, we actually do have caps on our rates. And according to our EMS director, LA County, rates can go as high as for a 911 ALS advanced life support call, $2,100. So you need to know, does your insurance cover that? So I called my insurance right away when I saw the story. I have a $20 copay. I looked at Covered California. They have plans that don't cover transport to plans that cover with a $350 copay. So as a consumer, it's very important that you call to see if you have this benefit covered.
So that's ground ambulances. Sometimes you see in trauma cases where a helicopter has to land and transport you. Are there costs associated with that?
There definitely are costs associated with that. EMS services can be very costly because you're paying for the transportation, the medication, the treatment, the trained personnel, 24-hour responsiveness. And if you require airport or helicopter transport, even more, because you're probably in an area that's not easily accessible, or you need to be air flighted to somewhere that has the services that you need. So those are more costly. However, if it's deemed medically necessary, oftentimes if you have the appropriate insurance coverage, a lot of it can be covered.
So who can we call if we do have a problem with ambulance service and or billing? Who would we call?
Well, the first thing is if you do have any issues, I would say call your insurance company first, because you may get a bill for ambulance services. You want to look at your explanation of benefits to make sure that you were billed correctly and that your insurance company paid. And if there are discrepancies between the two bills, then call the ambulance service and say, look, I was billed incorrectly, this is what my plan covers. Give them an opportunity to correct. And then if it's still very costly, ask your insurance company. There are appeals process. You can ask them to pay more. You can ask the ambulance company, can they please come down on some of the costs, because they'd rather have some money than no money. And then they also have charity programs and low-cost assistance programs where they can help you with some of your costs for these. But be an informed consumer, know what you're getting into, and use 911 correctly. You know, it's not for
Yeah.
your earache. It's truly for emergencies when you need them.
But I experienced something almost opposite because I had an emergency. I was driven to the hospital, not in an ambulance. I was admitted in that. Then when I got my bills and that, certain things they denied, and it came down to a question: did you come by ambulance or did somebody drive you? So how emergency was the emergency? Because I didn't take an ambulance, they denied some of the billing of things. So
oh wow.
Yeah.
So it's a little bit of an unusual case because most of the times it's the opposite where they're wanting to deny services.
Right.
Now, and I don't want to discourage people from calling 911. It's a very important service.
Yeah.
We have well-trained fire department and other companies contracted with them to respond. But you do need to be diligent about how you use it. Again, for emergency services, you know, and again, they may come out and assess the situation, like in your case, see if first aid is needed, treat, and may not need to take you to the hospital. But when in doubt, get the assistance.
More information about clinical nurse specialist Alice Benjamin. You can follow her on social media, and you can check out her website, AskNurseAlice.com. Thanks again. Good to see you.